Now let's talk about the elective abortion. Elective abortion is defined as the deliberate termination of the pregnancy in a manner that assures that the embryo or fetus will not survive. An elective abortion is done either by medical techniques or the surgical methods, and the abortion is an intentional process, whereas the miscarriage it is a spontaneous process, and the method of abortion is determined primarily by the period of gestation and also by the woman choice. Now let's talk about the medical abortion. So the agent used for the medical abortion are mifepristone, which is progesterone receptor modulator, and the misoprostol. Misoprostol is a prostaglandin analog, and the mifepristone increases the uterine contractility, and it also increases sensitivity to the prostaglandin, whereas the misoprostol then act on the sensitized endometrium to expel the embryo. Then the regime is mifepristone is taken initially, and it reaches its maximum efficacy around 48 hours, and it is then followed by misoprostol, which is taken after 24 to 48 hours later. So, if the period of gestation is less than 9 weeks, then the above regime of the mifepristone and misoprostol is taken at home until expulsion occurs. And due to uterine contraction, the pain occurs for which we give the patient NSAIDs. If the period of gestation is more than 9 weeks, then the same regime of the mifepristone and misoprostol are used, except that the misoprostol should be taken every 3 hours until expulsion occurs. And this process is done in a clinical setting under supervision. And if the period of gestation is more than 21 weeks and the woman want medical abortion, then we give piticidal agent to eliminate the possibility of the fetus showing any signs of viability. And the agents used as a piticidal are intracardiac injection of potassium chloride, and the intrapetal or intraamniotic injection of digoxin. Second one is the surgical abortion. In surgical abortion, we have two methods: vacuum aspiration and dilatation and evacuation. And vacuum aspiration, which is a surgical method of choice for the termination of pregnancy less than 14 weeks, and initially we dilate the cervix with the Hager's dilator and then do evacuation with gentle suctioning. And the sharp curata should be avoided as it is associated with increasing risk of uterine perforation and intrauterine adhesion. Initially, before performing the vacuum aspiration, we dilate the cervix, and the cervix is dilated with misoprostol, and the misoprostol causes cervical dilation and makes the cervical instrumentation easier. And the regime used is 400 microgram of misoprostol sublingually 1 hour before the surgery. And prophylactically, we give the patient antibiotics, and antibiotics are given to all the women undergoing surgical treatment to reduce the risk of infection, and prophylactic antibiotics are not necessary following medical abortion. Second surgical method is dilatation and evacuation. It is the surgical method of choice for termination of pregnancy that is more than 14 weeks, and it involves initially the cervical dilation and then aspiration and the extraction of the fetal tissue. And post of procedure ultrasound is performed to confirm that no product of conception are left in the uterine cavity. Initially, we give the patient cervical dilators to dilate the cervix for up to 20 mm before the procedure, and the agents used for cervical dilation are osmotic dilator and the misoprostol, and the misoprostol can be given orally, vaginally, or sublingually. Next is the management of the abortion. So in management, we do assessment before the abortion, assessment after abortion, and the contraceptives apart to the patient. So before abortion, we take a detailed history, we do examination, and we do certain investigation. Initially, we confirm the pregnancy, then we assess the period of gestation by ultrasound. We do sexually transmitted disease screening. Similarly, we also do complete blood count to look for the HB. Similarly, we also check the research status of the RH factor, and we also do the coagulation profile. And then we do either medical abortion or the surgical abortion. Then assessment after the abortion. So after abortion, if the woman is RH negative, we give the patient NTD immunoglobulins, which are given at a dose of 500 international units. And in case of uncomplicated abortion, no routine follow-up is required. And the contraceptives after abortion barrier methods can be used immediately. Hormonal contraceptives can be also used after abortion, and the IUCD can be also inserted at the time of surgery. And the last one is the complication after elective abortion. There may be incomplete abortion occur. There is increasing risk of infection and the bleeding, and there may be increasing risk of uterine perforation occur and the uterine rupture. So it was all about the elective abortion.